Yo, welcome to the Table Talk podcast, where we sit down, pull up a chair, and we get started. This podcast is designed to provide you packed full of information to help you with your training, nutrition, lifestyle, and well-being, where we interview myself through case studies to give you lifetime experience. And then we also interview high-performing individuals or other career-focused people who are looking to make changes in their lifestyle, training, nutrition, and well-being. So let's pull up that chair and let's go.
Welcome to Understanding the Human Body, also known as the Spine, with me. My name is Dr. Aimee Mason. I'm a chiropractor here in Sydney CBD. I have been practicing for 5 years now. I'd wanted to be a chiropractor since I was 12 years old. So a bit of a random cool dream for a 12-year-old. Didn't have any life-changing major accident or anything, as some people do. I just was lucky to appreciate, I guess, the body and the holistic side of the whole body at a very young age. So I saw that the body was a lot more about, so more than just pain. It was about how we store emotion in our body, how our whole body functions, our general health and everything with that. So I fell in love with the idea of being able to help people at age 12, and I've worked my butt off since to be able to do so. And it's exciting that I've been able to do that for some of you guys as well, which is really cool. So I'll try not to bore you too much today, but we're going to go through a little bit of spinal anatomy. If we can have a couple of extra slides, please, Carl. That's me. Hi, me. Next one. So we'll go through some basics of the body, go through the importance of the spine, why posture is so important, why our spinal nerves are so cool, what we can do to prevent bigger problems happening in the future. A lot of you have consulted with me before, but for those listening online have not, I'll give you a little bit of an overview of my approach to chiropractic. We'll go through some cool stuff on posture, some exercises, ergonomics, and most importantly for you guys, how it ties into exercise. Now, we'll be sitting for the next couple of hours or however long. Get up, move around as much as you want. I don't want you sitting here with awful posture for the next 2 hours while I talk about good posture. So get up, move, ask me questions all throughout. Bear with me as I stumble through things. Let's have some fun with anatomy. So, for those who aren't aware, the human body is composed of 11 major organ systems, each with its own special function. So the ones we'll be going into today will be mainly the skeletal system and the nervous system. Other ones include such as respiratory, cardiovascular, our skin, everything else that makes our body the amazing, intelligent being that it is. At birth, we have about 270 bones in the body. As we grow and develop, we have some of those bones start to fuse together. That's a good thing. That's what's meant to happen. So as an adult, we have about 206 bones. 33 of them are in the spine, which is cool. About 16% of the bones in our body is just in the spine. I'm a little bit biased being a chiropractor. I think that that's the most important 16% of bones in our whole entire body. And we'll start to talk about why. So a little bit of anatomy overview without going into boring you too much, but this is what we're here for today. This is my friend Sammy the spine. So we have 7 vertebrae in our neck, 12 vertebrae that make up our thoracic spine, 5 vertebrae that make up our lumbar spine, 5 in our sacrum and 4 in our coccyx. Coccyx and sacrum though are fused together, so they're considered one and one moving kind of vertebrae. We then have 3, or we should have 3 natural curves of the spine. Our neck should go this way, which is called a cervical lordosis. Our upper back should go this way, which is called a thoracic kyphosis. And our lower back comes into a lordosis again, so our lumbar lordosis. For some people these days, we see one big banana spine. Not looking at anybody in particular, but that's what we don't want to see happen. Because if we see all of that start to happen, which is becoming a lot more common these days, even people with mobile devices, looking down like this, what does that do to our spine? So we'll talk about some of the functions of our spine and of these little guys that come outside our spinal nerves and why they are important. I will refer to notes a couple of times just to keep me not rambling too much, so bear with me pretty please. So who can tell me why our spine is so important? What are some of the functions of our spine? Don't all jump at me at once. Liv.
The nerves come out.
Yep, cool. Luke, you don't get to answer. He's also a chiropractor, so that's cheating. Eddie? Pass. What does our spine do? Keeps us upright, number 1. Cool. keeps our spinal cord protected, so it works to protect our whole nervous system. Lets us move, so moving is pretty important. So whether we stand, move, sit, cross our legs, do all good or bad things with posture, we need our spine to be able to move. And pain prevention. If we have a healthy mobile spine, then we have less pain in the body. Any questions? Cool. Next slide, please. So support, protection, mobility, nerve function, pain prevention. There's a whole lot more that the spine can do, but that's, in my opinion, the most important structures of it. So when we think about all these kinds of things, and for people who aren't in pain, they're kind of less motivated to go, why should I care about my spine? What other things could it be doing? So I'll tell you guys a little story which will make sense as we go through some of the further slides on the spinal nerves, but this story sits pretty cool in my heart, and she's given me permission to share it with you guys today. So I had a very lovely lady last year start coming to me. She was 20 years old. She told me like she had back pain going on, was struggling with bracing, with deadlifting, with hip thrusts, that kind of stuff. She felt like she was going to pass out during a deadlift. She felt like she was going to lose bladder control doing hip thrusts. So I thought, all right, there's a lot of stuff going on around here. But then when we started to unpack her history a little bit, we actually talked a lot about her digestive system. So she had mentioned that as a baby, she was severely constipated. Through high school, she could only have a bowel movement every 1 to 2 weeks. When she had a bowel movement, it would take a good 1 to 2 hours of sitting on the toilet to get anything to actually happen. As she sort of grew up a little bit after high school, like doctors put her onto medication of like laxative basically to try to get things moving. She was still lucky to have a bowel movement once every 4 days. I said, cool, let's have a look at what your lower back is doing. What's your pelvic floor doing? What are the nerves in your lower back doing and how are they functioning? After doing a lot of testing, we found basically she had no pelvic floor strength whatsoever. Like that was just gone out the window. And all of the nerves in her lower back were screaming. So kept things really simple, did some just gentle pelvic adjustments, some work around that, decompressing the nerves in her lower back. The coolest thing I've ever had from a patient coming and running up to me and saying, Aimee, I pooed. It was great. Like, not a thing you'd normally hear from a chiropractic patient, but having someone so excited that they pooed that it took like 2 minutes, like a normal person. And that then from there, she was able to actually have a bowel movement every single day, multiple a day sometimes, no pain, it wouldn't take her hours. She goes, I can't believe how much time I have back in my life, simply because I can go to the toilet now. A lot of these things like we take for granted every single day. If we don't have pain or we don't have these problems, then we're like, well, what's the point? So I like that story because it highlights that there's so much more that's been going on in somebody's back or in somebody's spine that you have no idea is actually related to that or not. So that's my little story of Alyssa. Next one, please. Cool, so understanding the importance of posture. We know why the spine is important, but why is good posture important? Pretty similar functions that we go into, but really we talk about spinal health as a whole. So reducing the risk of back pain, reducing degeneration from happening in the spine, lots of those sorts of musculoskeletal things that we know can happen. But there's a lot of other reasons why it's also important, which I guess comes for anyone in the fitness realm is really important as well. Muscle function, number one, keeping people safe with training, number two. If somebody has an imbalance and if they're having poor posture throughout a day and then they come into the gym and they're already in a compromised state, what's that going to do to them? Like, are they going to be able to pick up a barbell and have perfectly even? What if they've got one lat that's really tight and they pull unevenly or bench unevenly? That can literally just be from the way that they sit at their desk every single day and it's setting them up for failure. So whether you're a client or whether you're a trainer, really, really important to know what sort of structural stuff is going on in somebody's life. So if you guys asking them the questions when you do your game plans, what do you do for work? How do you sit at work? What's your computer setup like? How much time do you spend on the computer or on your mobile or any of these things, and go through that sort of history with them, because that's going to give you and them so much more information that's going to keep them training safely. The other cool one with posture, breathing and organ function. So having better posture means less pressure on our organs, less pressure on our spinal nerves, which then control those organs. So for instance, if somebody's in this really hunched posture, really hard for them to take a deep breath. If you all sit really, really crappy now, Take a really big breath in. How hard is that? Sit up nice and tall. Open up. Take another big breath. See how much further you can breathe in simply from allowing the rib cage to be in a better position and the nerves to actually control that movement. So things we don't think about make a big difference day in, day out. Have you ever seen people with poor posture yawn a lot? Like they feel really tired and they yawn a lot? So actually a yawn is the body's way of forcing a deep inhalation. So if we've got poor posture, our body is naturally more tired. And then now I've talked about yawning, I'm making people yawn. It's my favorite thing. Carl did it to me yesterday. You better not make me yawn. I'm gonna make myself yawn. But if you're sitting in that bad posture all day long, your rib cage and your diaphragm aren't able to fully expand and contract. So then our body gets so tired that it literally needs to force that inspiration in and does that really big yawn. So things we never think about with posture. One of the ones I really like as well is just simply confidence in somebody's appearance. So I think whether you care about how attractive you are to the world or just simply feeling a bit of confidence in yourself, if you're carrying yourself around like this all day, you don't look like a very confident person, you don't feel like a very confident person. Whereas if you simply pull yourself up, have that nice big open chest, you're suddenly gliding around, floating on air going, yeah, cool, like let's get on with the day, let's do it. I had a patient yesterday say to me, he only started 2 or 3 weeks ago, and he goes, I feel so confident. He goes, I didn't know that could happen, but I feel really confident. When he first came in, he was literally sitting like this in reception. And I said, how would you rate your posture? And he goes, oh, I think it's okay. I'm like, cool. Because you know when you sit in reception on your phone, you're like this, right? Do you think that that's good posture? And he goes, oh, no. Whereas now he sits in reception beautifully, has his phone up in front of him, and he comes in yesterday, he goes, I feel so confident. And like, that's very cool. Like, so young guys, if you want to get the girls, you want to look sexy to the girls, sit and stand better. They'll go, wow, that looks like, oh, I like him. Also shows off your muscles a little bit more. You know, you work hard on them, or it will make your non-existent muscles pop a little bit more too. Don't worry. Okay, spinal nerves. So this is when some of the anatomy stuff will get a little bit heavier, but I've got slides that cover it all, so you'll be able to reference back to it. And I also have little handouts for you guys. So in clinic with our new patients, we often refer to a nerve function chart. Now, this isn't exactly what's up there, but it gives you a really pretty picture. I should have just handed it to you and passed them around, but here we are. Cool. So I love talking about the nervous system to my patients because a lot of people think chiropractors crack bones and they put bones back in place. Yes, we look at the spine. The spine is where some of the bones are, but we look at the spine because it holds our spinal cord, our spinal nerves. It's how our brain communicates with the rest of our body. Our nerves control literally every single thing that we do. So if there's pressure on an area of the spine, that's going to put pressure onto those spinal nerves, and then that can inhibit the nerve function. Kind of like if you think about a garden hose that's kinked, the water's not going to be able to flow out, or it'll flow really, really slowly. So we need to find that section that's kinked, unkink it, and let the messages from the brain to the rest of the body flow nicely again. So we're going to go through a couple of slides. Thank you, Carl. So we talk about what level of the spine controls what in the body, because then if someone's coming in and they have neck pain, but then they also have, visual disturbances, or they've got lower back pain, but they also have constipation, like in the story before, or for women, menstrual issues and that kind of thing. This literally gives us that map of here's why. Here's what level every single nerve of the spine actually controls. So upper neck goes into our intracranial blood vessels, so it controls everything around our head and our brain. Think of everything up here. So our eyes, nose, throat, glands around here, headaches that come from the base of the skull, the front of the head, behind the eyes, that kind of stuff. Interestingly, C4 also connects to our diaphragm, which is a really fun one. So people who do a lot of cardiovascular stuff or running, cycling, whatever, and they get really, really tight through their diaphragm can also have neck problems because of that nerve relation. So that's the only real one that's quite far away from where the nerve runs. That's just a fun fact. Lower neck comes into neck, shoulders, arms, down the hands, our grip strength, also part of our heart, lungs, chest. So every time someone has some weakness, or not every time, sorry, when people have weakness, pins and needles, things like that coming into their hands, poor grip strength, that can come from the lower neck. The lower neck is also what gets severely compromised with people's posture. So when they head forward, that's what drags on the lower neck there. So people who work at desks a lot, most people now just have poor posture for their neck, partially because of phones, partially because of devices. And the world is also just kind of below us. Everything is down here. So we're always looking forward and down. Next one, please. So upper thoracic comes into our arms, comes heart, lungs, chest, voice box. Mid-thoracic spine, arms as well, heart, lungs, so that's all fairly similar. That's kind of that general cavity. As we get a little bit lower, we come into our liver, our diaphragm, stomach, spleen, kidneys, and then into our digestive system. And as we get lower, we start to come into uterus. As we come into the lumbar spine, for women, we come into reproductive organs. Sorry, I'm ahead of myself. That's all symptoms there. And legs, so lower back as well comes into knees, feet, etc. So lots and lots and lots and lots and lots of stuff that comes simply from our spine. Kind of tells you how much can go wrong in the body if someone is not looking after their posture. Does that scare you a little bit or motivate you a little bit, or both? Good, excellent. That's what I want to do, because it should. Because people who aren't in pain currently go, why should I bother? Because it's hard. Why do I want to put in the effort to look after my posture? This is why. It's our whole entire livelihood. It is literally everything in our body, and we're damaging it, basically. Okay, cool. So now they've given you a little bit of motivation and scared you a little bit, we want to now look at preventing big issues happening with good posture. So I'm going to use Carl in a second as a demo for a muscle test, basically showing how someone in good posture versus bad posture can suffer without knowing it, without being in any pain with it. So, Mr. Carl, can I come and have you sit, please? Okay. So if Carl sits with really poor posture, slumps through there, has the head forward. As we now know, that puts a lot of pressure onto the nerves in our lower neck. Those nerves are what control the muscles down through our arms and hands. So if you stay in that position, I'm not going to fake this, I promise. I'm going to use the same pressure on both ones. Okay, I want you to push up against me. Come on, push up against me.
No, go again.
Oh, okay, I'll really exaggerate so it shows I'm not cheating. Still without you. Sit up nice and tall now. Think wide through the chest. Lift the chin there a little bit. Bring your arm here now. Push up. Different posture. Nice. Thank you. So I like that little trick, and it's not a trick because you saw me not, like I pushed so much harder on the second one. You cannot cheat that because that's just simply our nerves. If they cannot send the messages to our arms, if they're being strangled, the water can't get through the hose, the messages can't get through the nerves, and we're going to have weakness. We're going to have imbalances. We're going to have muscle tension. All of these negative things can start to come on. So if you're not in any pain, still good motivator to look after your posture. Cool. So things that we can prevent by looking after our posture. Pain obviously is pretty obvious. Illness. Now I say illness because like we just learnt from the nerve function chart, all of these organs can be related to our nerves. So if we have pressure on our nerves, what's that going to do? One of the first things I'd ever heard Carl say to me, a question he'd asked the team, was who are the only people to never ever get sick? Okay. Who are the alive people who never get sick? Say it
What
once.
was that, Eddie?
Yeah, people with good posture. People with good posture. So imagine that if we carried through life with beautiful posture, we'd never get sick. I shouldn't say we'd never miss a day of work, because that'd be a motivator for some of you to have poor posture, but that's really cool. Theoretically, if we all went through life with perfect posture, we would actually get taller as we age, not shorter. We hear about people shrink through poor posture. Well, words, Amy. We hear about people shrinking as they age. That's because most people don't go through life with good posture. So then our discs get dehydrated and we get shorter as we age. If we had perfect posture all the time, and we stayed moving and we did all these wonderful things for us, the spine would actually pump spinal fluid through it like an accordion hydraulic kind of process and thicken the discs. So it actually hydrate our discs as we get older, and therefore we could actually get taller. So not that you need to be taller, but still, these are really cool things. If you don't want to shrink, have good posture. Injury, obviously for you guys, go back one for me, sorry. Injury is the biggest one that you guys need to be mindful of, because you guys are looking after people, and for those listening, you're the ones training as well. So super duper important that we can prevent that. So looking at someone's technique. You guys as trainers, what's an example of something you've seen with a client who goes to pick up a barbell or whatever, do an exercise when they're all twisted or offset with their posture? What's a negative thing you could see? Yeah, cool. So we can pull through the back. We can, have a bench that's uneven. We can squat, and oh god, some of the squats are people's rotations. They actually come down and like, are you salsa dancing as you're squatting? Like, what's happening? They've got this really awful rotated pelvis. So imagine that, and then putting 60 kilos over their back. That's going to make your discs and joints and nerves and everything really, really happy. Not. So injury, muscle tension obviously builds up as well if we don't look after our posture, so that's a nice motivation. And then I've put degeneration there because nowadays with people's poor posture, I see so much early degeneration in spines. I see 20-year-olds necks who look like 70-year-olds because everyone now is growing up on devices. So we're down like this. So we're changing that natural curve of our neck. Instead of it being this way, it's now coming up very straight. And for a lot of people, it's actually reversing and going the opposite way. Having that uneven loading through the joints then wears them out. We get degeneration or arthritis through the spine at a very, very young age. And what's that going to do? It's going to completely destroy the nerves, create all the pain in the arm and set them up for a whole lot of future. So at a young age is a really good time to start thinking about your posture, but at any age, it's never too late. I'll add in a little extra story about my dad. So dad's now 71, almost 72. He was seeing me in the student clinic, so 6 years ago. So mid-60s at the time. Dad had been a computer programmer for 40 odd years. Back then, no one was really talking about good workstation setup and monitor heights and whatever else. So my dad had many years of this. Dad's a tall man, he's 6'3", so he developed a really nasty, like exaggerated kyphosis. He also had a little bit of a scoliosis, which is the sideways curve, so he had that and that. So that was the trajectory Dad was going into. Dad goes, no, I've got terrible posture. What's the point of coming to see you? You're not going to change anything. I'm too far gone. I'm too old. No, there's no point. I said, Dad, let's just have a look. Let's see what we can do. Let's see if we can improve your posture a little bit. So he comes in. Everyone's still mobile. Everyone still has a chance. His spine isn't fused and he's got no chance. So I did work with what I could for him, taught him some postural stuff, some simple stuff. Within a couple of weeks, Dad's now nice and upright. He had his school reunion, like 40-year school reunion or something ridiculous. And I saw this picture of him with all of his friends, all of his mates down like this, and then my dad standing like he's 6'7". I kid you not, I cried. I was so proud of my dad and seeing this man standing so tall above his friends because he said, no, it's too late for me. I'm not going to be able to change my posture. So at any age, it's never, ever, ever too late. Cool. So for some of you might be motivated by a picture like this. This is what we don't want to end up like. And that's kind of what my dad would have ended up like if we didn't work on him. So yay, Dad. Cute. Okay, so a little bit of my approach. For those of you who haven't seen me before, you hear a lot of negative things about chiropractic. So I guess I kind of want to debunk that a little bit, because nowadays on the internet, there's all videos of people cracking and ripping heads off and all sorts of nasty stuff, to the point where there's now all sorts of comedy reels and all sorts of things on TikTok and Instagram, basically making fun of our profession. Unfortunately, that's been allowed to happen because of the chiropractors who are posting all of these videos and things onto Instagram and not really helping our cause. So a lot of people now, when they hear chiropractic, they think, oh, you crack backs, you crack this, or you crack that, or you put things back in place, or they don't actually see the side of what we do that's really holistic and comprehensive, or what should be. Like, I've had new patients come in and they go to jump straight onto the table, and I'm like, no, hang on, like, come sit down, we're gonna have a chat first. And they look at me really surprised. I'm like, well, what did you think I was gonna do? They're like, oh, but in the videos, like, they just come in and crack. I'm like, no. So I guess I want to debunk that idea, just give you a quick little overview of how I approach things, and then we'll carry on. So indulge me for a couple minutes. So patient comes in for whatever reason, and I always start with a history. Regardless of anything else, always start with a history. So we chat for about 20 minutes, not just about the area of pain or their problem, but about their past history, past injuries, general health problems, how much water they drink, coffee, alcohol, smoking, all of that kind of stuff. I get looks from people of like, why are you asking me about my bowel and bladder habits when I've just got lower back pain? So then I get the opportunity to educate them, like how I've explained about the spinal nerves, of how that can all relate together. So we go through all of that in depth. From there, we can proceed to an examination. So I do a really thorough examination looking at spinal nerves, posture, range of motion, how everything is functioning for the body. And again, that's not always just at the area of pain. Like, it can be a whole body examination. It can be lower back and legs and feet and everything else going on, because we follow what the nervous system is doing. From there, we then go through options for care. So if someone needs something that's not chiropractic, or refer them out. If we need to do x-rays or something like that, we discuss that as well. And if it is safe to proceed with care, then we discuss what the options are. So I'm not a one-size-fits-all approach kind of person. No one gets adjusted the same way. It's always about what's finding the safe and appropriate technique for every single individual, rather than just get on the table, let's crack you and get out the door. Not my style. And then we spend a fair bit of time educating. So the stuff that I'm about to go through with you guys in terms of posture, postural exercises, that kind of stuff, giving people information about their own body. It's amazing how so many patients have seen all these other health professionals. No one's ever taken the time to actually explain to them what's going on in their body. It's empowering knowing what your problem is, because then you're actually motivated to look after it for yourself, or to just simply know why you're having to go through this process, why I need to come back for another visit, why it's not just a crack, put things back in place and off you go again. Like, the expectations some people have, like they've had a constant back pain for 20 years and they're like, oh, it's not just going to go away in one visit. No, it's not. So we spend that time educating on why, and just giving people that understanding of their bodies. So that's really, really important. So that's my little approach. Whether you want to see a chiropractor or not, if you're not in Sydney and you want recommendations, reach out to me, or if you just simply have questions as well, I'm more than happy to answer that. Let's carry on that. Cool. So when we talk about posture, I use the 4 S's of posture. So we sit, stand, and sleep symmetrically. Do not backbend, please. I'm going to explain what Tom just did when he stood up, which is very common. Tom just stood up and went, and wrenched his back backwards. That's really damaging, because you're compressing through the joints in the lower back and squashing all those precious little bundles of nerves that we've just learned about being really, really important. So when you're stretching the lower back, stretch yourself forward. If it's for your mid-back tension, stretch your arms across your body. Don't squash the shoulder blades together. Thank you for doing that terrible thing, because it let me help everybody else. Okay, So when we sit, stand and sleep symmetrically, we want to think everything we're doing balanced. So we'll start with stand, even though it's the second one, because now I've got you guys up and standing. So standing evenly on both feet. A lot of people very commonly stand bending, so they shift all of their weight off to the side. Evenly on both feet. Bring your weight so it's more over your heels than your toes. So we want to think 80% of the weight on your heels. Pull up tall out of your tummy. So like you're doing up a zipper, pull up nice and tall out of the tummy. Think wide across the chest and relax the shoulders down. Our head then floats. We don't really have to think about where our head is. So posture comes from here, not here. We have all of this posture because all of that's collapsed. So again, think even on both feet, up tall out of the tummy, wide across the chest. Relax the shoulders down. Beautiful. Now if we sit, we do the exact same thing. When we sit evenly, not crossing the legs, you can cross at the ankles, that's okay. When we cross at the ankle, we're not putting this big twist onto our pelvis. When we cross knee over knee, ankle over knee, we've got that really big rotation happening through the pelvis. So sit evenly through the cheeks. And again, we pull up nice and tall, wide across the chest, relax the arms down. And that's it. It's not hard. It really shouldn't be hard. People overcomplicate posture. We just want to think like you're doing up a zipper. Have that as your little mantra all throughout the day. Pull up, nice and tall. If you're sitting in a chair that has a back, sit all the way back into it. People sit far forward on seats. That immediately sets you up for poor posture. You're then going to do that because you don't have anything supporting your back. So if you're sitting in an office chair, have the seat nice and upright so it's supporting your spine. Sit all the way back into it and pull up, because that also will help to engage your pelvic floor muscles, engaging those lower abdominal muscles, and help you to stay in that position more comfortably. A lot of people say that they find good posture uncomfortable, which is a sign that they've been doing poor posture for a really, really long time, and that their brain is now convinced that that's what normal is for their body. So we need to change that idea. It takes time, it takes effort, but once you've done it, it should be comfortable. The best complaint I've ever had from a patient was someone coming in and saying, so like the pain's gone, but now if I sit with really good posture, it's really comfortable, but when I slump, it hurts. I'm like, great, amazing. Like, no, but I used to be able to sit with bad posture and it was fine, it was really comfortable, but now it hurts. I'm like, but when you sit upright, it's comfortable. They're like, yeah. I'm like, great. So I explain why that's a good thing. It stayed in my head because I just think that's really funny, like someone complaining that their bad posture is now uncomfortable. That's your brain whinging that it wants you to sit with better posture. Not as much with the neck because our neck, question was, so as we extend through our lower back, which I lectured someone for just before, it compresses everything in the lower back. Liv's great question was, if we do the same thing in our neck and extend through there, does that have the same negative effect? Basically, no. Our neck and our lower back range of motion are different. So the degrees of range of motion for each part of our spine are different. Our neck is designed to be able to extend more. Our lower back, unless you've grown up doing gymnastics and have crazy, disgusting flexibility of extension, shouldn't go into that excessive amount of extension. So it doesn't have the same effect. I don't like people staying in an extended position for the neck for a long time, but it's not damaging moving it in that plane. Any other questions while we're here? Have a little pause.
Yeah, with this on there, so shin split.
Yes.
Why?
How would, sorry, could you? The nerve in the sacrum?
Yeah.
So the question was, how is the nerves in the sacrum related to shin splints? Basically, it's just the distribution of where those nerves run in our body. So because they'll come down through into the lower leg and also into the big toe, for one, it can create a poor gait pattern, so like walking, running pattern, so it adds uneven pressure onto the muscles. Shin splints is also a little bit of an outdated term that I don't love. It's just more poor biomechanics around the shin. So Didn't realize that was on that chart. Not a great one, not a great example of that. But basically the muscles that the nerves in the sacrum innervate, plus changing the biomechanics like through the foot as we walk and run. Any other questions? Cool. Okay, so it was our sit, our stand, our sleep. Oh, I like my meme. Take a minute to appreciate my meme, please. This one Tom will particularly enjoy. Yeah. Cool. Okay, now we can move on to the next ones. So posture shouldn't be difficult. Now we know the basics of posture. We can have some fun little exercises to make it easier to maintain these positions. Because posture is hard when the right muscles aren't switching on. It is tiring sitting up with better posture because most of us aren't used to doing it. So sitting with those muscles not switched on is much, much harder. So we're going to learn a couple of exercises that helps to switch those muscles on. If any exercises give you any pain or discomfort, or if you're unsure about what you're doing, don't do them. If you're not here with me at the moment, send me a message, send Kyle a message, reach out to someone to support. If any exercise ever is giving you pain, don't do it, ask someone for help. Good rule of thumb for everybody. So up we get. This one, very simple, single leg balance. Cool. So we're going to start in our lovely standing posture that we now know. We're going to lift up one leg so it's parallel with the ground. So you want your knee bent at 90 degrees, your hip bent at 90 degrees. We want to think driving our weight through the heel that's on the ground and pulling up tall out of the tummy. Good. Now, what I don't want you doing is leaning to try to get your balance. So if you can't do that, staying up nice and tall, get something nearby you that can support you. I don't want you holding onto it the whole time, but it just helps you to rebalance a little bit. So we keep thinking up tall. Hold. Good. We should be able to hold that for 60 seconds. You start to get a little bit tired with it. Keep squeezing the quad that's touching the ground, pushing through that heel that's contacting the ground. Pulling up nice and tall. Good. Let it drop down, other side. Let's go again, because otherwise you're all going to be really imbalanced. Cool. So again, driving through the heel, pulling up tall through the tummy. If people are really good at this, you can close your eyes, but have something you can hold on to. Taking out that visual input makes the balance a little bit harder. As we do this, we're getting the nice big muscles in our thighs waking up. This also helps with energy production. So if you're sitting at the desk feeling tired, stand up for 2 minutes and do this. You'll be surprised how much more awake you start to feel. Keep pulling up. Engages our pelvic floor muscles, engages a little bit of the muscles in our lower back, engages our glute medius, which are big stabilizers on the side of our hips. I'm clearly not as good at this one, or I'm just distracted because I'm trying to talk at the same time. Cool. Good. Nice. If that's really hard for you, start at 30 seconds, build your way up. Once you get to 60 seconds and it becomes really easy, take away that visual stimulus, close your eyes. If you get super, super good at that, and then closing your eyes for 60 seconds is really easy. Add on to it with a little bit of an uneven surface. So whether it's a towel, whether it's a little wobble board, Bosu ball, whatever it is, have something that's going to challenge the stability underneath your ankle. That's super advanced. Please don't start there. I don't want any injuries because of this exercise. Any questions? Cool. This one is lat activation. So this is my favorite exercise that I give to people who work at a desk. Most people down like this, and then when they try to sit up tall, they find it really, really hard. Their traps get super duper tight and everything just becomes really hard. So you can do this one sitting or standing. Just stay standing for the sake of, you guys being upright for a little bit. So we want to think again, tall up out of the tummy, wide across the chest. Bring the arms by your side at 45-degree angles. Now, because so much of what we do is forward, using our flexor muscles, whether we're typing or whatever we're doing, we want to think the opposite. So we want to get our extensor muscles working. So extend your fingers, extend your wrists. So you're already going to feel a little bit of tension happening through the hand and the forearm. Great. So we want to hold that position. And then we want to pull our elbows down towards the hips. So we're not squashing backwards. We're pulling down. So you should be feeling that here underneath the shoulder blades in at the armpits. So fingers out, flared, arms at 45-degree angles, pulling the elbows down towards the body. Squeeze for a couple of seconds and relax. Then we say relax but don't collapse. So what I mean by that is relax the arms but stay in that upright position because you've just primed these muscles in your back to keep you upright. Don't immediately then go back into that because you're just going to turn it all off again. So if you're feeling tired, if you're struggling to sit up nice and tall, repeat this one as much as you want throughout the day. It takes all of 3 seconds to do. Think up, out, pull the elbows in. Couple of seconds, relax. If you're struggling to feel that underneath there in where the lats are, I'll get people to do it with a little towel roll to start with. So have something there against the body and you're aiming to keep that in towards the body. Did anybody struggle to feel that in their lats then? Yeah, cool. So Dylan just said he started getting cramped from it. That's because Dylan is not used to using those postural muscles. So the muscles, like when we use something for the first time and it's challenging for it, they start to cramp and twitch a little bit. So that's a good sign. Keep practicing it. It means you need it. Yeah. Eddie, did you have a question?
Yeah, I started to feel moment below the belt.
Yep.
Yeah, it's more like below the belt, that tricep.
Cool. So Eddie said he's feeling a little bit more below the delt and into the tricep. That's because Eddie has lovely external rotator muscles that he works. So Eddie has much better posture than what a lot of people do. So it's less obvious for him in the lats. As you externally rotate and squeeze it in, you're going to feel your triceps a little bit. You're going to feel a little bit of posterior delt coming in, wrapping into that side point there. So that's a little bit more subtle feeling it in there. So you might be better off with a variation of external rotation, just bringing the arms back and forth. And as you pull out, really thinking about squeezing those elbows in towards the side. You'll still feel a good bit of tricep, but you should also feel the lats working. If anybody struggles with that one, come and chat to me afterwards and we can go through it again. Next one. All right, I'm going to need a volunteer. Don't all jump at once. Yay, Blair. Okay. Cool. Pause for a second because I'm going to sneeze. I'm going to borrow this one as well. Okay. Blair, could you please come and lay on your back for me? Yeah, head up there. So before I do this for Blair, I'm going to do a little pelvic floor test. Now this one's just extra special for you guys to see the potential benefit of doing this exercise. Do you have any lower back pain at the moment? No. Cool, beautiful. So you think, cool, everything's functioning well, there's probably nothing wrong with me, right?
Yeah, sure.
Yeah, sure. Let's have a look. Now, I've never assessed Blair before, so there's a good chance that I'm going to have egg on my face in a second. She's going to be super strong and this whole experiment is going to be pointless. I'll come around this side so that you can see. So I'm going to test her pelvic floor muscles. I'm going to get you to hold your leg there for me, and I want you to push up into my hand as hard as you can. Ooh. Go again, push up. Okay, and relax. This side, push up. Much stronger on that side.
Okay.
Cool. Did it feel easier on that side?
Yeah.
You could all see that difference, right? Push up. Push up. Big difference. So watch what happens. Bend your knees for me. Lift your feet up. Okie doke, relax there. This is really trippy for me. I always practice on this side of the table, so trying to stand on this side of the table is breaking my brain a little bit, but I'll do it for you guys because you're extra special. So starting with your knees directly over your hips, we want your knees at 90-degree angles and your hips at 90-degree angles. We start this just with breathing and deep tummy breathing. So as you take a big breath in, I want you to think about blowing out the belly. Good. Breathe out and pull the belly in. So think about it like a big balloon in the belly. As the air comes into it, the balloon expands. As you compress the balloon, the air comes out. So it's opposite to how a lot of people breathe, because a lot of us breathe up here through our chest, not down here through our diaphragm. Our diaphragm is our primary breathing muscle. So if we're not breathing deep into the tummy, we're losing that power of our diaphragm and making our rib muscles, our neck muscles work much harder than what they need to be. So practice that for a little bit for me. I like people doing that just to get into that routine of breathing deeply. From there, we add just a subtle little tilt in the pelvis. So it's called a posterior pelvic tilt, which I'll come around the front. Posterior pelvic tilt is tilting the pelvis backwards. So if you imagine this like a bowl of water, if you're tilting it backwards, the water's going to spill onto you. If you tilt it forwards, the water's going to spill out onto the floor. So forwards is anterior, backwards is posterior. So as you breathe out, you're going to have that little tilt backwards in the pelvis. So it's not using glutes, it's not using hamstrings, it's just curling in towards yourself a little bit. So take a big breath in for me. Breathe out and curl the pelvis in towards you. Good. And hold. 2, 3, and relax. Big breath in. Breathe out, pull the belly in and curl at the same time. A little bit more, a little bit more. Good. Hold. 2, 3, and relax. Big breath in. Breathe out and curl the pelvis same time. So start curling the pelvis at the same time as you exhale, okay? And relax. Big breath in, push the belly out. Breathe out and curl, same time. A little bit more curl. Good, hold. 2, 3, and relax. Who's counted? You guys are all PTs. How many reps are we at? 5. Big breath in. Breathe out, curl in, a little bit more. Hold. 2, 3, and relax. Let's do 2 more for good luck. Big breath in. Breathe out, curl the tummy, curl it in, curl it in, curl it in. Good, hold. 2, 3, and relax. Good, last one. Big breath in. Breathe out, curl in, good, hold. 2, 3, and relax. And just for those watching at home, because we all love when the PTs add an extra rep in when they told us it was going to be the last rep, we're going to do one more just for fun. Big breath in. Breathe out. Curl the pelvis in at the same time. Good, and hold. 2, 3, and relax. Beautiful. Okay, let that all relax down. So once you get used to this, it should only take about 2 minutes or so. It should become easy. But if you're doing it at home, I want you to practice that breathing for a good 5 minutes first, just to get yourself into that pattern of breathing. Now we retest. Start with the good leg. Hold here, push up. Good. This one, hold, push up. You can see I'm not faking it. How did that feel?
Better, yeah.
Much easier, right?
Yeah.
So we've just switched on Blair's pelvic floor muscles and made that so much easier to control that power in the leg. So things that can seem like it's weakness is actually just the muscles aren't able to switch on because it's in the wrong position or it's been deactivated with poor posture. Pretty cool, right?
Yeah.
Nice.
That was cool.
Great work.
So are those pelvic floor muscles like here?
Yeah, so
On the skeleton?
pelvic floor muscles sit basically like a little bowl in our pelvic bowl. So they're the muscles that relax and contract with bowel bladder movements. So like our sphincters basically that let you go to the toilet. It's what also stops all of our organs from just splushing out onto the floor. So that acts as the foundation of our spine and of our abdominal muscles. If you've got weak pelvic floor muscles and all you're doing is your sit-ups and planks and all of the big core muscles, it's not going to matter. You need this working to then have the rest of it working. So that's really important to have nice, strong pelvic floor. Things that switch off pelvic floor muscles, poor posture, crossing legs, excessive coughing, intercourse, anything where we're having to strain a lot there. If you've had a really big bowel movement and you're having to push really hard, all of that switches off. Men and women have pelvic floors. This is not just some mythical thing that pregnant women grow. Only pregnant women seem to talk about pelvic floor muscles. Everybody has it. It's important for everybody. So everybody can be benefiting from this exercise. So when we've done any of those things that turn it off, we want to turn it back on again. Because most of us don't sit with perfect posture all day, or we might have, bowel movement or whatever it might be. Pretty much all of us are switching off our pelvic floor day in, day out. So we need to be then switching it back on again. Any other questions? Cool. So that's my 3 favorite little postural exercises. I've got some stuff on ergonomics. The 2 big areas I've put on for ergonomics are the most common that we see for people, so desk workers and everyone on their mobile phones. So a couple of basic things of going through good posture with sitting at the desk or with sitting on your mobile phone. If I go around onto this side of the table, am I going to be seen? Yep, cool. So I'm going to set up my little office. Okay. So we want to think, like I'd said before, if you're sitting in a desk chair, sitting all the way back into the chair so that the upright part of the chair is actually supporting your spine, not angled backwards so that you're then slumping into it or leaning forward on the edge of the chair. I don't like desk chairs with really big arms on them because for a lot of people they can't actually get close enough to their desk. It stops them from getting underneath the desk. So I like it if people can slide in underneath their desk so they're actually here. Obviously this isn't a desk, we're playing make believe, whatever, but I like the example of having it underneath it. A lot of people's desks, if they can't do it, reach out to me and we'll find a better solution for you because sometimes offices are just already setting you up for failure. But bring the chair so it's all the way underneath you so that you're sitting underneath your desk. That way you're not trying to reach towards it or sitting on the edge of your chair and slumping into it. So I want to think nice underneath it. Bringing computer so it's arm length away and the monitor so it's up nice and high. The top third should be in your eye level. So if you can see over the top of your screen, it's too low. Keyboard and mouse in nice and close to you so you're not having to reach and extend for anything too far. And then we come back into our nice symmetrical sitting posture, pulling up nice and tall. Arms should be able to relax by our sides. If this is all too far away, we're already going to be compromising our posture. So we need everything around here to be set up nicely and work for you, not work against you. Cool. Mobile phones. Who thinks they use their mobile phones with really, really good posture? Carl actually does sometimes walk around the city like this and I love it. He looks like a maniac and it's fantastic. Do you reckon like all of you sit using your phone down like this? Is that fair to say? Yeah. There's no judgment in it because it's what everybody does. Dylan is perfect. Dylan has like the best posture I've ever seen with anybody. For anyone who doesn't know me, that was serious sarcasm. Okay, so I sit on the train and I do not care if people think I am taking pictures or filming them or look crazy because my spine isn't hurting like theirs probably are. So if I'm sitting on the train and I've got my backpack with me, that's great because it gives me some support to rest on. If I don't, if you're not traveling with a backpack or if you're not sitting with a bag or something you can rest on, tuck one elbow in towards your side, create a little cradle for yourself with your hand. Let that elbow then rest in it. That then lets you have your phone up in front of you. For a lot of people, they find it's really hard to keep it up there because your arms get pretty tired. So that allows you to have a little bit more support there and it makes it more comfortable. Swap arms because yes, it gets tiring, but if you've got something you can put on top of you, like a bag, you can then... That's a very big backpack, but it's my example. You can then rest your elbows into the top of your bag and sit there on your train or your bus or whatever for your daily commute and go through like that. So it's up in front of you. That's going to lift your chest up, lift your head up and stop you from being... Cool beans. Cool. All right, favorite topic for you guys? If you can't answer some of these questions, then we're really disappointed. No, I won't be, but I want some good involvement here because this is your area. So, significance of spinal health and exercise. Why? Why is it important? Why do we give a crap? Eddie. Yep. Yep, so we can load the muscles more evenly, so have better balance through the muscles and more aesthetically pleasing. Yeah, nice, love it. What else? Prevent injury. Bingo. Because do you want a client who's injured and can't keep coming back and training? Or do you want a client who can keep smashing it and get bigger and grow faster? Yeah, nice. I want non-injured people too. Did you have one, Liv?
If all the nerves can like run really free,
Yep.
our muscles can contract more effectively.
So if our nerves are not all bunched up, being compressed, they can do their job better. Muscles can contract more effectively. Happy days. Better breathing, so for better recovery. Fantastic. Love it. Anything else? Illness? Yeah. If we're not sick, then we can come back to train and keep up with our goals and everything. So injury prevention is probably the biggest one for you guys, because we want to keep people safe at all times, and that allows them to continue achieving their great goals. Come back, train again, have a great session, not be in pain. Did it stop again? Oh, cool. You shook your head. And, my director is terrible. I'm kidding. Yes, have a better session, keep hitting our goals, train safely, be happy. Structural support as well. So we want nice, good, stable, happy alignment through the body, because that's going to make for more effective lifts, whether it's cable, whether it's free weight, whatever it is, body weight. We still want that beautiful alignment through the spine, because then we can have better weight distribution and reduce risk of injury. Power generation as well, which sort of comes back into what Liv was saying with better nerve conduction, not having the nerves all mushed up. Our muscles can do their job a lot better, so we have a much stronger position. Like what we just did with the pelvic floor exercise, imagine that. We've primed the muscles, we've got them in a really good position, the nerves are able to talk to the muscles better. Imagine what PBs you're going to start hitting. How good? And yeah, that's it. So examples of some poor and good techniques. Who wants to demo? I was going to get Carl too, but if he doesn't want to, does anyone feel confident in demoing some good versus bad deadlift and squat techniques for me? So we're going to demonstrate good versus bad technique for deadlifts and for squats. A couple of really, really big things to look out for a deadlift. That number one, probably that we see the worst, is people who pull from their back. Eddie, without actually lifting it, because I care about you too much to damage your spine, could you please demonstrate just pulling on the bar with a really rounded back, what that would look like? Eddie has such beautiful technique, it's hard for him to even demonstrate bad technique. That's going to unevenly load our spine, compress our spinal discs, and create all sorts of havoc. So that's the worst thing that we want to do. If you can't do a deadlift without rounding your back, you either shouldn't be doing it or it is far too heavy for you. So please come and talk to one of the team. So Eddie, we're going to start you with a lovely stance. You're going to focus on your hip hinge, engaging your lats and keeping a neutral spine for me, please. So before Eddie even lifts, you'll see he'll take the slack out of the bar where he engages the lats and then stands. You can see his back is beautifully neutral. There is no round in it. He's driven through his legs. Lats are engaged the whole entire time, up and down, and he is magic. Thank you, Eddie. So we're going to have Blair demonstrating a lovely squat. We're going to show some terrible technique and some great technique with Blair. We have not loaded the bar up, so that way we're not compromising Blair's spine as she does the bad technique. So a bad technique would look like, if you want to set yourself up, Blair, please. So bad technique can look like uneven foot placement. So if you're not concentrating where the feet are, being evenly distributed, if one's really turned in or one's really turned out, if you're rounding through the back excessively as you're coming up or down, yep. Or if we have what we'll call a butt wink, which is where one side of the pelvis will flick up a little bit, or you'll flick into a little bit of a tilt back or forth because you don't have stability and control through your pelvic floor, through your lower back, through your pelvis. So it's very uneven, poorly loaded squat. So if you can now set up for a beautiful squat for me, we want to start with good foot placement, tends to be just outside hip width apart, but go for your squat technique, talk to your trainer. Usually feet slightly turned out, but again, however feels comfortable for you, because hips are all shaped differently, so position is different for every individual. We want to think breaking at the knees and the hips evenly. So what I mean by that is as you lower yourself down, your hips and knees are going to move at the same time. Pushing the bottom back, good, and pushing the knees out at the same time. What we don't like seeing with a squat is very unstable knees where they collapse inwards on each other. So as you come down again for me, Blair, really focus pushing the knees out to the sides, good, and back up again. Lovely. Done. So why is it important for your trainer to know about your spinal health or for you to know about your spinal health? Then they can actually take into account your strengths and weaknesses, compromised positions and everything else that can impact your training. So that's why I love working with Vitruvian Health, because they actually take the time to get to know you, to do a postural balance assessment, to see where you're compromised, where you're not functioning very well, and talk about these kinds of things. That way they can personalize training for you. If you weren't able to do a squat in the way that we've just demonstrated, if you've got weakness through your glute med or something's happening, they're then going to tailor that into your program and create appropriate warm-ups and exercises to get those muscles working so that you have a nice balanced and symmetrical spine and musculature as you then progress through your exercises. What does this mean? We get to do progressive training. So as one of the VH fundamentals, we want to be having nice progressive overload where we are increasing in whether it's reps, sets, time under tension, whatever it might be. This actually allows for that progression through your training. People I find who plateau a lot through the training, it's because there's some other structural imbalance happening that hasn't been addressed and they're not actually able to progress past that certain point. So we need to know what's great, what's going to keep you safe and allow for that gradual progression in intensity and complexity. Any questions? Eddie?
Coming back to the backpack.
Yep. Cool. So Eddie just asked a question about coming back to the backpack. I'm just going to pause and start a new one there. So talking about wearing backpacks, Tom asked a question before of, is it important to have your backpack higher or lower on your spine? We want to think about having the straps nice and tight and pulled in so that it sits the backpack between the top of the shoulder and ideally either just above your lower back or just into your lower back. People wear their straps really, really loose and it tends to bring all of that weight of the backpack down here, pulling them into this slumped position. You see it a lot with the school kids with their really heavy backpacks that pull that all down into them. Not ideal. So we want to think nice and tight in the straps, as comfortable as it can be through the chest there. So it sits your backpack up nice and high through the base, at the top of the shoulders, base of the neck, through to the lower ribs, depending on the length of the backpack. If it has a chest strap as well, putting that on, you might feel like a little bit of a dork. Who cares? Much better for your posture because it's going to keep you stabilized. Also, always wearing the backpack on both shoulders. One of my biggest pet peeves is people who have a backpack slung over one shoulder and they walk around like this. You're not cool. You'll look silly and it's terrible for your spine. Please don't do it. Both straps on, nice and tight. Pull that up. Eddie just had a question on wearing backpacks on the front. So is it okay to wear a backpack on the front? I'm perfectly fine with it because it actually doesn't tend to pull you forward. For most people, because the backpack is going to sit higher up, it actually, if anything, lifts people up. The only thing I don't like if someone is wearing a backpack on the front is if it's too much and it's actually pushing them backwards and they end up with a lean. If you can comfortably have your bag on the front and maintain that nice upright position, great. If your bag is too big or too heavy, it might not be possible to wear it on the back. Speaking of heavy bags, packing a backpack, anything that's heavy, pack it towards the spine, so have it so it's against your back. Anything lighter, out to the front of the backpack. If you've got the heavy items further away, it's going to pull you backwards as well. So anything heavy like a laptop, have it closer in towards the spine. That's typically why backpacks are designed with that laptop compartment close to the spine. Cool. So Blair has just asked one of my favourite questions about she gets back. Is it okay if I share your question? So she personally gets back pain around her period. So this is a really, really common thing that we see for women. Symptoms like back pain, whether it's just before the period or during the period, after the period even, there's a big correlation with pelvic position because it's actually influencing the uterus position. So for most women, I think 80% of women have an anteverted uterus, so it more tilts towards the front. For the other percentage, it's tilting towards the back, a retroverted uterus. We can also have a little twist on the uterus. That can all happen simply because of how it's suspended within our pelvic rim. Our uterus is suspended within ligaments, so as that attaches onto the pelvis, if we've got really poor pelvic positioning, that's also going to create uneven torsion onto the uterus and create added pain, unnecessary pain. For some women, it's going to be a little bit of an unavoidable thing depending on conditions like endometriosis, PCOS, they're going to struggle with it more. But for most women, back pain with periods, we can absolutely work on and help, but some are more likely to have it versus the other depending on how their uterus is positioned. But yeah, very common, all ties together. Great question. That's a wrap. That's me. This is me. Reach out to me through email, through our website. If you want to have a consultation with me, we've got book online function there. Make sure you mention that you're from Vitruvian Health and we can give you special benefits there. Reach out to me on Instagram, Dr. Aimee Mason. If you have any questions at any point, whether it's about your posture, back pain, anything else that I can help you with, I'd love to be able to connect. So go for it. Thank you.
Hey, thanks so much for joining the episode of Table Talk today. We hope you found some helpful tips and inspiration in staying healthy and fit, even with a busy schedule. Be sure to subscribe to our podcast. Stay tuned for our next conversation. Until then, keep prioritizing yourself, your health, your fitness, and we'll see you on the next Table Talk.